Okay, so this is our pelvic model here. This is the front of your pelvis. This is the back of your pelvis. If you are standing, this is what it looks like from the side. This is what it looks like from the back. Here we have your lumbar spine. This is your sacrum. Your coccyx is right here. And this is the pelvic floor from the back external view. We always have our glute musculature that goes around this direction here. So those are removed. So we're only seeing the pelvic floor here. This is the rectal opening. This is the vaginal opening. We are going to be focusing on this region right here called the perineum. What you're going to do is insert one finger. I like to use my thumb facing this direction. You're going to insert your thumb only to the first knuckle, maybe even just to the nail, the end of the nail. So you're going to insert your thumb into the vaginal opening just till that space, till that first knuckle. You are going to lightly hook your thumb down and then pull on the perineum this direction. So if this is us sitting on the toilet, you've placed your towel over the toilet opening. From the front side, you're going to basically be having your thumb right here, pressing downward, okay? So you're pressing down onto the perineum, and you're just going to hold that stretch. So you can see what a thick tissue this is. It's a very thick muscle. You're going to be stretching, pulling downward this direction. You're going to hold that stretch while you are inhaling, okay? Inhale, stretch, exhale, relax. Inhale, exhale, just like that. You can slow that breath down to make your inhale last for 4 to 5 seconds. Just like that. You can also hold the stretch while you breathe in and out, but I would start with stretching on the inhale, okay? This should not be a significantly uncomfortable stretch. It should be nice and gentle. Once you have done somewhere between 8 to 15 reps of the breathing and the stretching, just pulling straight down, you're going to keep your finger inside the vaginal opening. You're going to gently press outwards, and you're going to do the same thing. Then you will switch over to this side. You'll gently press over to this side. You'll do the same thing. Once you have stretched in all of those planes, so you've done the middle first, then the left or the right, doesn't matter which one you do after that, then you are going to keep your finger inserted. You are going to start on this side, and you're going to make a U shape, just like this. So we're stretching that tissue right there, okay? You can do that for 8 to 12 reps as well. And you're going nice and slowly. If you struggle with any dryness, you could use some lubricant to help make that more comfortable. You can also do the same thing rectally. So you'd be inserting index finger into the rectum, only to the first knuckle, no deeper than the first knuckle. You would be pulling forward. So again, remember this is the back. So we're pulling forward towards the front to stretch the perineum. You would be pulling down. Again, you're going to inhale, exhale. Inhale, pull down to stretch. Exhale, we relax, okay? Then you would do the same exact thing. You'll go to the side, you'll go to the other side, then you'll make that U motion up and down with the inhale, okay? Those are going to be the two that you're going to want to start with to do a perineal massage postpartum to help with any scar tissue that may be there from stitches. Because remember, the grade 1 tear is going to be only through that part there. Grade 2 can be anywhere in this region. Grade 3, we get into the rectal sheath. Grade 4 is a complete tear. So for the grade 2, there could be any number of stitches in here depending on the degree of the grade 2. You could have had just a small tear up through this region, or it could have been, a more significant tear. So start with the vaginal techniques first and then move to the rectum. Do not use the same 2 fingers. Do not change fingers. Make sure that you are washing your hands, being very clean with this, taking all precautions that way, and just start very, very gently, very small. Remember how thick this tissue is. It does take quite a bit of force to help this tissue stretch. So those are the 2 internal techniques you're going to do. The external techniques, you're going to take 2 fingers, clean, you have washed your hands at this point. You're going to press straight down on the perineum. I'm saying straight down, but remember, you're going to be sitting on the toilet, so you're pressing upwards. You're going to press on this structure down. You can roll your fingers back and forth. You can try to pinch this area and roll. That's very difficult to do, especially if there are stitches in place and you already have some hypertonicity going on. But you can do a lot of external techniques as well, just pressing in between these 2 areas and rolling your fingers back and forth in multiple different directions. Okay? You can see how complex the fibers are in this area. It's not just straight up and down like this muscle is over here. It goes every which way. So take your time with this and work on those techniques to help with your perineal healing.